Hello, I'm Dr. Priya Matthew at MVP Family Dental, and I'm here to talk to you a little bit about dental infections. A tooth infection is a pretty serious problem, and it develops by a few different ways. So you could have a cavity that has been there for a long time, and cavities tend to get bigger and bigger if they're not treated. So, if it's this small and we fill it, then you're good. But if it keeps getting bigger and bigger, it goes to the pulp of the tooth, which is in the center. And then that's connected to where the roots are. So basically, the infection can go into the roots and then go outside of the root because it's trying to find the path of least resistance. So then that hurts. So once it gets into that nerve chamber or the pulp in the middle, you're in trouble. Another way that it could be caused is through your gums, your gum problems. If you haven't been to the dentist in several years, you start getting gum infections. Basically, you haven't had a cleaning and the bacteria is sitting there on your gums. Most common symptoms of dental infections would be pain. Sometimes you can get a swelling, which is also called an abscess, and sometimes you can get drainage of pus. That is a big sign of a dental infection. Pain, waking you up at nighttime, or just like even when you're chewing and you have pain, maybe the pain's not all the time. A more severe infection will be pain all the time. A dentist can tell the difference between a cavity and an infection by looking at the x-ray that we would take. So say you came in for an emergency visit, we take our x-ray, and that's how we can see what's going on with the tooth. Because a lot of times you can't tell just by looking with your eye clinically. We need a little bit more information. The risks of having a tooth infection untreated would be that the infection could spread. I have heard instances of the infection spreading to the brain and possible death. I've heard of children who have died from this. I've seen a child in the hospital because I did a residency at Abington Memorial Hospital down the street for a year. So we were doing our rounds and all that stuff. And basically I saw a child in the hospital because of a large dental abscess. And this child had to go on IV antibiotics. I've seen many people, adults, with having to get IV antibiotics because of dental infections. So there's a lot of risk involved. You can go as far as death, but it can be very uncomfortable and it can lead to your whole body getting infection. There are different treatment options available for tooth infections. Of course, we would have to take a look first. So you would want to come in, get your x-ray and exam by the doctor. We can take a look and see what is needed exactly. Sometimes we can save the tooth. We always want to save the tooth if we can. If there's enough tooth structure left, we want to save the tooth. So we can do a root canal treatment and a crown to restore that tooth back to health. Or sometimes we have to extract the tooth, unfortunately, if there's too much broken down or it's broken down into the root, then we have to take it out. And then also for gum infection, you can definitely get treatments done by our lovely hygienists who are very highly trained. We can clean your teeth, do the deep cleaning, which is called scaling and root planing. We can even put antibiotic into the different areas, and we can also prescribe antibiotics for you. There's lots of ways to treat them. Natural and home remedies may help with an infection, such as, saltwater rinsing if you have a gum issue or an abscess, but that's not going to solve the problem. I've heard of clove oil, but it's really just a Band-Aid and kind of a weak one. So you would want to come in and get it checked. The most common signs of an infected wisdom tooth would be pain around the wisdom tooth, especially in the gums around it. A lot of times in the back of those wisdom teeth, people get a little bit infected. Or you might see a big cavity in there, or you have pain that radiates in your jaw, into your ear sometimes, or up to the upper jaw. There's lots of ways it can manifest, but that's why we're here. You come in and we'll let you know. So an infected wisdom tooth is treated many different ways. Of course, we have to see exactly what's going on, but if it's super infected, usually we would refer you to get them extracted with the oral surgeon. Sometimes if it's just one infected tooth, you might want to get the opposite wisdom tooth out too, because that could lead to problems and you're already at the oral surgeon, and then the opposing tooth likes to come down if there's no tooth underneath it. So sometimes we just refer you and get them both out, or even all four. It all depends on a lot of parameters such as your age, how infected it is, exactly what's going on. Is it a big cavity? Is it a small cavity? Is it a gum problem? Et cetera, et cetera. You can call us at 215-887-7171 and ask for me, Dr. Priya Matthew, or my mom, Dr. Vinitha Thomas. Thank you.